नमस्कार, मैं हूं डॉक्टर मनीष सिंघल, मेडिकल ऑन्कोलॉजिस्ट, अपोलो हॉस्पिटल नोएडा एंड दिल्ली से। आज हम बात कर रहे हैं 5 थिंग्स टू डू व्हेन यू आर डायग्नोज्ड विद कैंसर। आई थिंक व्हेनेवर अ कैंसर इज डायग्नोज्ड और सस्पेक्टेड, it is an earth shattering news for you and you go helter skelter. But that is not the right way. Don't get panicked. The first and the foremost thing to react or to do once you are diagnosed with cancer is not to panic. There is always help available. There is always experts available who can guide you through your journey of this particular earth-shattering disease. So please panic ना करें. सबसे पहला काम तो आपको यही करना है. I'm not saying कि panic नहीं होता, panic होता है, but it is best not to panic. Sit back, think that what is the closest cancer center near you. Take an appointment and meet the expert, the oncologist. So one can decide whether you want to meet a surgical oncologist, medical oncologist, or a radiation oncologist, but I think any oncologist is good enough. So the second thing is book an appointment in the closest cancer center and meet an oncologist. The third thing to be done is understand your disease. If your oncologist is not giving you time, take the advice of another oncologist who can give you time. It is very important that unless until you understand the disease, you will never be able to take the right decision. अगर आप अपनी बीमारी को समझेंगे नहीं या समझ नहीं पाएंगे तो आप कभी भी अपने बारे में सही डिसीजन नहीं ले पाएंगे। और ये मैं समझता हूँ कि ये ज़िंदगी के हर पहलू के लिए बहुत ज़रूरी है, सिर्फ कैंसर डायग्नोसिस के लिए ही नहीं। सोचो, समझो, फिर करो। ये बात हमें हर बार हमेशा सिखाई जाती है, बचपन से सिखाई जाती है, और ये बात यहाँ पे भी लागू होती है। सोचो, समझो, फिर करो। So please understand your disease. It is absolutely okay to ask your doctor that I would like to read about it. मैं पढ़ना चाहता हूँ इसके बारे में, मैं समझना चाहता हूँ। Cancer doesn't kill in one day. It doesn't kill in 1 month. Unless until you are late, very, very late already, or you were misdiagnosed. That's a different thing altogether. But cancer is a slow process. You have time. You can read about it. Ask your doctor where you can read more about it. Your doctor may be very busy. He may not be able to give you more time, but you have many questions. So it is okay to have questions. Read about your disease. There are beautiful websites which explain the disease, which make you help you understand your disease, and that will help you take the right decision for your treatment. I can give you one such website. One is www.cancer.gov. It's a very beautiful website, the National Cancer Institute website of US. It gives you in a very, very subtle, very simple manner what you need to know about the type of disease you have. Understand the treatment paradigm from the doctor. The fourth is, after that, it is important is we establish the diagnosis and the stage of the disease. We need to know what type of cancer it is. Many people are apprehensive about taking a biopsy. They think that the biopsy will lead to spread of cancer, and my answer to them is, if biopsy is only to be implicated to the spread of cancer, why should cancer spread even without a biopsy? We do get many patients in stage 4 cancer upfront when they have never been biopsied. That means the natural history of the cancer is to spread to other parts of the body. If biopsy is only to be implicated, why do we get cancer who have never been biopsied in stage 4? We get them all the time. So these patients have never been biopsied. It was upfront stage 4. The cancer spread even without a biopsy. So biopsy is not to be implicated for the spread of the disease. In today's world, the biopsy is done by very safe techniques, by keeping a trocar and shooting the gun within the trocar and releasing the trocar. So there are experts who do this biopsy, not something who is a naivete will do the biopsy. यानी कि biopsy वो लोग करते हैं जो इसमें सक्षम है करने में, जिनको पता है कैसे की जाती है. So जो fourth step है वो है diagnosis को बनाना, making the diagnosis and making the stage of the disease, because ये दो चीज़ें बहुत important है आपका treatment plan को बनाने के लिए. And the fifth is taking the treatment. Take the treatment where you are confident. Yes, The doctor has spent time, he understands the disease, he knows what type of treatment. I have read about it, I know this is the right and the best treatment. With full self-trust, trust on the medical fraternity, and with the social support or the support of your family and the support of your friends. This is how you can win this battle. I am telling you, many people falter because there are a lot of feeders. Within the fifth point, I will tell you very importantly, don't go by hearsay. You may have a lot of well-wishers, you may have a lot of good wishers, but these well-wishers are to bless you for your treatment, for the success of your treatment, but not to give you advice. You got to take advice only from people who are capable of giving advice, who have the authority to give advice. The authority of giving advice on treatment is with the doctors that you are taking treatment with, not people who are non-doctors, not people who are non-oncology doctors. I think it is very important that this advice should come from people about treatment and what needs to be done from experts and not from just anybody. So don't go by hearsay. Take the advice of doctors who are qualified to give you an opinion. Their advice is the most important to take the treatment. So in short, do not panic. Book appointment with your doctor, the closest doctor, so that you can go up and down easily. You don't have to travel long distances. Understand the disease. Ask for websites where you can read more about it. Ask questions. Release your doubts. Write your questions, then go to the doctor. Do diagnostic workup. Understand the treatment. Take proper advice and shun away unqualified advices. And that is how you are going to build the best possible treatment. Thank you.